Teenage obesity today is increasing at a steady rate. Economics plays a role, and with the rising unemployment rate, now estimated at 8% in the country, we're going to see families making probably more and more choices based on how many dollars they have in their wallet, and not based on what the food pyramid says that we should be ingesting. A stark reduction in the number of physical activity programs that are required in our school systems. There is a much greater emphasis placed on academics, and that's not to say that it's inappropriately placed on academics. However, when you are really just measuring and quantifying performance based on one area, that is academics, to the exclusion of other areas that may actually have an impact on health, like physical fitness programs, I think it's easy to imagine that this also contributes. Another way to look at obesity is simply as pounds overweight. And depending on your height, as few as 20 or 30 pounds overweight would qualify one as being obese. The estimate, and this is a few years old now, for taking care of all of the complications of diabetes is about 25 cents out of every healthcare dollar that's spent in America today. If you look back to the 1970s and compare 30 years later, the incidence of childhood obesity has tripled. This has also been in parallel with an increase in the prevalence of adult obesity. My fear is, if unchecked, a number of consequences will be realized. Those consequences include a decrease in the number of quality years of life for many, many Americans. Prevention of obesity is a difficult task, but prevention efforts certainly do start at home. They start at home in terms of meal preparation and eating meals at home. They start in the grocery store when food selection choices are being made. And they start when people, which do what people do, which is to go out to eat, really look at menu items. And helpful prevention efforts include looking at menus that quantify calories and quantify ingredients in food to help individuals make healthy choices, both when they're out to eat and when they're in the grocery store. It's a multi-factorial problem that probably has just as many possible solutions, and it really takes a family, it takes healthcare providers, and it just takes people with good common sense sometimes to get their arms around this problem.